Hi, my name is Heather Wokusch, and thank you very much for joining us. Now, the Fukushima Daiichi nuclear disaster really is kind of showing no end. It is becoming more serious and more serious, even now, over 30 months after this happened. And it raises very, very serious questions, not only about what is going on in Fukushima, but about the sustainability of nuclear power and basically anything nuclear globally, long term. But unfortunately, these topics just are not really dealt with in the mainstream media, and so we are delighted today to be joined by Dr. Andrew S. Kanter, who is the past president of Physicians for Social Responsibility, and Mari Inoue, who is a New York-based lawyer specializing in immigration rights, and she also is very, very active in Human Rights Now New York. So thank you so much for joining us. I was delighted and honored to be able to speak to both of you last year about this same topic. And unfortunately, not much has improved, and it has only gotten worse in that sense. But before we get into that topic, can you give us each just a bit of background about how you got involved in this area? So how about you first?
Okay. I was involved in Human Rights Now New York since end of 2010, when they're applying for the consultative status with the ECOSOC, which is the Economic and Social Council of the United Nations, so that once they get this status, they'll be able to observe the UN meetings and also make some statements or distribute written statements on behalf of citizens around the world in order to represent them and share their voices to the international community. So I was involved with that process. And after that, there was a nuclear accident in March 2011. And that's how I started to get involved with the situation in Fukushima and how people were affected and how NGO will be able to help them in sharing their voices to international community. Okay, super. And how did you get involved in this?
Actually, I've been involved with nuclear issues since I was a teenager, actually. The first activity I was involved with was in the mid-'70s in California when there was a nuclear reactor safety initiative on the ballot there. But it was really probably the early '80s when I joined the Physicians for Social Responsibility as even prior to being a medical student, concerned about the connection between nuclear power and nuclear weapons and the ultimate threats that this really threatens the whole planet. And so there's a constant, very tight relationship between nuclear power and nuclear weapons, and so I've been following that really ever since.
Okay, fair enough. So let's look at what is going on right now in Fukushima. Okay. Now, can you tell us a little bit, can you give us a background and focus maybe on the water issues?
Sure. 2.5 years ago or so when this all happened, we were all very much concerned about what was going to happen to the cores or the reactor fuel that was in those reactors. And that we were dumping water, not we, but they were dumping water on to keep it cool. And that was a big concern. And so this water was being poured onto the reactors. The fuel has actually melted through, despite that, into the buildings themselves. It's sitting on the floor, you have to imagine, into the basements of these buildings, and that they're still continuing to have to dump water onto these cores of the reactors to keep them from further melting and exposing even more and more people to the radiation. At that time, we were worried about where the water was going to go, and so the water going into the ocean was a big problem. But now it's become even worse, and that is that they knew, but we didn't know at the time. Is that
and I'm sorry,
yes.
They is?
Well, the TEPCO certainly and probably the Japanese government knew that there was an underground river, essentially. The groundwater flows down the mountains underneath the reactors into the ocean. And what was happening was that these reactors had been damaged by the earthquake, and the water was actually flowing into the buildings from this groundwater. It was also flowing out of the buildings into the ocean. And so they were starting to pump furiously to try to get the water out of the reactor buildings. That's why there are these hundreds of tanks around the reactors now where they're trying to store this water. We can get back to that in a minute. But what was happening was the water was continuing to flow. It's like a river. And so what they first tried to do was actually dig some wells upstream to try to pump the water out to keep it from going into the buildings. You can imagine trying to stay upstream of the Hudson, trying to pull the water out. And that didn't work. And so they then built a wall, or they basically solidified the ground underneath between the reactor and the ocean to try to keep it from going into the ocean. Well, that worked for a little while, but you can imagine what happens with a dam is that the water starts to fill up, it fills up, it fills up, and eventually it goes over the top, which is what's now happening. So the water that has been in those reactors, highly contaminated water, is now going out over this sort of earthen dam underground into the ocean.
Now, you're a medical doctor. What are the health implications, not only for the people around Fukushima, but also in New York and elsewhere?
So the real concern, of course, is that all radiation is dangerous, that the more radiation that you get exposed to, the greater the risk is for you, and across a population of people, the more people exposed to radiation, they will have health effects. So the water that is now contaminated outside the reactors is not staying outside the reactors. We have now been told that in the next maybe 2 years or so that water through the ocean currents will actually reach the United States. Now, of course, it's highly diluted by the time it actually reaches the United States. So any individual person going to swim in Los Angeles or off San Francisco is not going to have to worry about their personal risk, probably. However, when you imagine millions of people having exposed to this radiation, then there are going to be measurable risks. And there will be cancers that are caused by this. But the more important concern actually is the wildlife, the fish, and the food supply. Because they actually swim a lot faster than the water does. And we've already detected radiation from Fukushima in the fish that have reached, let's say, Seattle. And so I think what really for us now the concern is keeping an eye on that food supply, not just for the Japanese people, but also for exports from Japan to the United States, that we need to be carefully monitoring them for radiation, because in that situation there is a higher concentration, and it gets bioconcentrated in the food chain, and we do have to be very careful about who young people, particularly women, getting exposed to this radiation in the food that they're eating.
Wow, so there's a medical perspective, and it's very frightening. But now, as a lawyer, I mean, isn't there some kind of international framework that will protect citizens from excess radiation?
We wish, right? But in reality, we don't have that much international framework that will protect from human rights perspective. One of the constructive approach that NGO could do in this kind of situation is very slow process. One of the things that Human Rights Now have done was that I believe it was July 2011, we submitted a request to United Nations Human Rights Council to send special rapporteurs to Japan to investigate the situation after the Fukushima disaster. We requested 3 special rapporteurs. One was special rapporteur on the right to housing, special rapporteur on toxic water, and special rapporteur on the right to health. And only the special rapporteur on the right to health responded. And he investigated the situation in Japan in November 2012, which was almost like 2 years after the nuclear accident. And his investigation was quite independent and unbiased in that he wasn't paid by the United Nations. He's not an employee of the United Nations. And he conducted meetings with government officials, executives of TEPCO, leaders of community, civil society groups, and also people who are directly affected by the Fukushima disaster, as well as the tsunami and earthquake. And he submitted the recommendations in May in Geneva.
And in May 2013?
Yes, this year, yes.
And what were they?
Well, basically, he was asking Japanese government to change the national policy based on the 1 millisievert per year standard. What happened was that before the Fukushima disaster happened, the national standard of the radiation dose limit for public citizens was 1 millisievert per year. And somehow, after the disaster, the Japanese government raised that standard to 20 millisieverts per year.
Well, that's convenient.
Yes, and in order to establish evacuation zones. So evacuation zone was established based on this 20 millisieverts per year, even though we are not 20 times stronger after the nuclear accident.
Right.
And which doesn't make sense at all. So a lot of people are still living in highly contaminated area in Fukushima Prefecture. And school lunch program is provided using local produce, for example. And food safety standard is not adequate yet. Many children are still living in that area. And this kind of issue has to be raised. And we started to see some health effects from these neighborhoods because Japanese government started to do the thyroid exams of children who were 18 years or younger at the time of the accident. And I believe that 170 or 180 children were tested already for thyroid exams. And I believe 18 children were already diagnosed with the thyroid cancer already.
Thyroid cancer, and that would be at a higher rate than the normal population.
The Japanese government says, these thyroid cancers are not related to the accident, and they might have found because we conducted thyroid exams. And I believe that 25 additional children were suspected with having thyroid exam. I mean, with the thyroid cancer. So they are going through further medical examination to find out whether that is.
And so you have this UN guy who did this study, and he recommended that the Japanese government change its, shall we say, over-optimistic, levels.
Yes.
You've got these cases of thyroid cancer that are not being addressed, or they're somewhat being overlooked. So in general, we have a situation in which the people are not taking responsibility and just kind of passing the buck. Now, have you found anything? And so I would like to ask both of you, do you think that the medical tests that are being conducted are valid tests, or do you know of any cases in which possibly
they should, I believe that exams should be expanded, not just for the residents in Fukushima. Right now, they're providing medical exams to children who are 18 years or younger at the time of the accident, which was March 2011. Adults are not provided with thyroid exams. Residents outside Fukushima Prefecture are not provided with the medical exam at all, even though radiation plume didn't stop at the prefectural border.
Right.
So they should expand and provide medical exams to those residents which are suspected of being exposed to radiation dose of 1 millisievert per year standard because that was the standard, national standard before the accident. And when there was a nuclear accident in 1999, I believe, in Japan, Japanese government provided medical exams to residents outside a nuclear facility when they were suspected of exposed to radiation dose of 1 millisievert per year. So I don't think it's adequate at all.
Okay. What would you add to that?
Yeah, for that and that specific question, I think that's absolutely on point. And the Special Rapporteur's report did make that advocate for that expansion. I think the other thing that has to be aware of is that what is happening to the people that are being monitored, and do they have access to proper care? There was a lot of effort to sort of prevent people from going on and getting second opinions, from following up on the information that they were getting from the government, which is very much against normal medical practice, and that I think it represents, and which was highlighted by the report, a pattern perhaps of trying to repress or prevent the real information from getting out. So if those people were really concerned about their health care, they should be allowed to go see a second opinion doctor, and those doctors were not being allowed to even talk about it or to mention it, and they weren't even supposedly allowed to even see the patients as their second opinion. And so,
allowed by whom?
By the government. So what we're seeing here is a pattern of government and industry in trying to obfuscate or sort of repress information about how serious this accident really is.
Yeah, and we have seen this again and again and again, you know, for the past over 30 months. Now, just recently, of course, Japan won its bid to have the Olympics, and part of this was that the Prime Minister Abe said, "Oh, our water's fine, don't worry, I'll take personal responsibility." And then right after, some people said, is he lying or is he just not informed? You know, and so there's all of these questions. What do you think about the whole issue of Japan having the Olympics? Any opinions there?
Well, one of the concerns I have is that he might continue to make the kind of statements to downplay the situation in Fukushima, because the situation is so grave. And international society should pay more attention to the situation in Fukushima rather than what's going to happen in Tokyo in 2020. But he made a clear statement that everything is under control in Fukushima Daiichi, which is not true. He also said that there was no health effects and will not see future health effects from the Fukushima disaster, which is not true.
Because we haven't looked.
So is he going to continue to make that kind of false statements over and over again in order to have the Olympics in Tokyo? Because he needs to promote safety in Tokyo in order to achieve the Olympics.
Yeah, but there's also a question, are people going to allow him to say that with not asking follow-up questions? You know, is also another issue, you know, I would say here. What do you think regarding the health implications of holding?
Well, first of all, I think an important point to mention is that you know, the Fukushima accident is not going away anytime soon. It's going to be around there for decades, and so certainly it's going to be present during the time of the Olympics. The pattern of sort of repression and perhaps misinformation about this is of a big concern. Another example of this recently was the measurement of the radiation around these water tanks that I mentioned earlier. And there's hundreds of these tanks around, and they had been always reported, oh, it's a low level, it's only 100 millisieverts, which is 100 times what the population would be exposed. But it's still a relatively low dose for workers who have to work around these plants. We now find out that the reason why it was only 100 millisieverts was that the tool that they were using to measure this only went up to 100. And that actually, when they went in with the appropriate detector, it was 1,800.
Wow. So
that theoretically, a lethal exposure could occur for a worker who happened to be hanging out for 15, 20 minutes around one of these tanks. And so this, either the tanks are now more highly radioactive because this stuff is settling and we have to worry about it, or it's just this repeated pattern of somehow not giving us the real story.
Yeah, I mean that is just, I mean, it borders on, I don't know, criminal, I would say, you know. I think what's also interesting is many times you hear that TEPCO, the company that's in charge of these reactors, is, too big to fail, and so the Japanese government is pouring basically taxpayer money into this company and pouring and pouring and more. And that's also an issue. I mean, clearly, the health effects and the global implications are one, but also this is just bankrupting. I mean, the Japanese people, not bankrupting, but it's just siphoning money off in a way that is so irresponsible, but also who's paying for it is the people, yet once again. And so it's this collusion between the government and also big industry. So I guess the question is, you had said, well, I think that the international community should pay more attention and do stuff. What do you guys think should be done by the by the international community for Fukushima?
Well, definitely they should look into what's going on in Fukushima, and because this is not just a Japanese issue, it's going to happen anywhere in the world as long as we have nuclear facilities, or there will be other possible scenarios for radiological contamination, and we don't have enough international framework to protect citizens from radiation exposure from human rights perspective. They have some standards. But World Health Organization is not taking a lead in establishing policies to protect people. And Mr. Anand Gruver, the UN Special Rapporteur, made his statement in his recommendations that we should stop, the Japanese government should stop risk-benefit analysis and has to look into their domestic policies from human rights perspective. Because the concept of right to health is to provide the right to everyone so that they'll be able to live in a healthy environment. It's not just about majority of people will benefit, but it's about everyone will be able to benefit from that right.
Okay.
And in order to share that his ideas and his recommendations, we decided to co-organize Physicians for Social Responsibility and Human Rights Now New York decided to co-organize an event on March.
An event?
Oh, yes. It's open to public. Admission is free. And we're going to do this on October 24th near the United Nations. And everyone is invited. And we're going to have Mr. Anand Gruber, the UN Special Rapporteur on the Right to Health, as a guest speaker. And he's going to talk about recommendations on Fukushima report. And also we are going to talk about another report which is coming out very soon to the United Nations. It is called the Fukushima Report by the UNSCARE. It's the United Nations Scientific Committee on Effects of Atomic Radiation.
My goodness, okay.
It's a very long, you can call it UNSCARE report on Fukushima. And this is going to be submitted to the United Nations General Assembly either this month or next month.
And my understanding is that this report basically played down the risks.
Yes, we read the press release that was published by them in May 2013. And basically they said that there was no immediate health effects or unlikely to have future health effects from Fukushima nuclear disaster.
Why do you think they said that?
And that will give a wrong
probably.
message to the media, also a wrong message to the world. And what is scary is that what we need to worry about is that once this report is submitted to the General Assembly, and if the General Assembly endorses this in a resolution, it could become international norm. And the recommendations made by Mr. Anand Gruber might be ignored. So we have two different reports on Fukushima from scientific and human rights perspectives. And we wanted to discuss in our events on October 24th about the implications of those two reports and how this is going to affect to not just to Japan, but also to people in United States or anywhere in the world, because this could become international standard in such a way, and we want this.
Well, I mean, that's very interesting, and also I love the name Unscare. Don't be scared. But you've got this whole, basically, you could say, in a way, cover-up of what's going on there. That's one thing that the media is doing. Another thing that the media is rather not doing is connecting what's going on in Fukushima to what's going on here. I mean, we have nuclear reactors all over the place. How would you make the connection between these two?
Well, as the Physicians for Social Responsibility has been saying for a long time, that there's implications to these decisions for our energy, and nuclear power is neither clean nor cheap nor safe for our energy supply. And we have about 104 of these reactors around the United States, many of them the exact same configuration as the ones in Fukushima. The former head of the Nuclear Regulatory Commission has actually come out and said, really, that all these reactors either should be shut down or at least turned off until safety implications from Fukushima could be applied to them. But
when did they say that?
Actually, I'll have to get back to it. But it was a while ago, and
nothing has happened.
And nothing has happened, and that is because there's a huge amount of money and special interest behind these technologies. And I think one of the things that people are constantly going to be reminded for the next 30 years about in Fukushima is that, wow, this is really dangerous, and this is what could happen to your country, or you can imagine what would happen if that plume hadn't gone out over the ocean in Fukushima, but had actually gone from Indian Point right out over Manhattan. Or all that water, that contaminated water that is now dumping into the ocean, that is being theoretically diluted quite a bit by the ocean, was actually coming down the Hudson River. This is not something that we would want to have happen here. And there are many places throughout the country, and perhaps even around the world, where this risk far outweighs the benefits of the energy, and we have much better, safer, sustainable solutions for our energy.
Well, let's just end on a positive note, and we've got just a couple of minutes. as an individual, what can I do? Well, one, I can go to the Physicians for Social Responsibility website. You've got all of these cool activities for people to do, action things and stuff like that. Human Rights Now also has a very interesting website. What other things would you say that people can do to empower themselves, just very quickly?
Well, they could talk about these issues with their friends, neighbors, share the information through social media, Facebook or
and you're good
Twitter.
at it. Or you both are.
Yeah,
I love
Yeah.
getting your updates.
And let a lot of people know, because once this kind of nuclear accident happens, people without resources will be the one who will be affected.
Okay, that's a
so
good
if
point.
they cannot evacuate, then government will basically give up on you,
Okay,
and you have
good
no
point.
choice to but remain in a contaminated area.
Okay, super. Last minute.
And so certainly inform yourself about it. It's really important to pull your head out of the sand and be aware of what the implications are. This is not going away. It's still extremely dangerous. And so first become informed and then talk about it, and not refuse to accept the status quo. And particularly when special interests, whether it's the government or the industry, tell you that everything is okay, don't worry about it, don't be scared.
Don't believe it.
Yeah. be very scared. And take action. And take action.
So we thank you so much for having joined us.
Thank you
very,
so
very
much for
Thank you for having
inviting
me.
me.
And we thank you for having joined us as well. And the whole point of this is not just to be, drowned in a bummer. It's more that these are really serious issues that are not being addressed enough, but you can empower yourself with information. So we highly encourage you to go to the websites that are showing on the screen right now, and also continue to insist to be informed and continue following this very, very, very important story. And we thank you for having joined us.